Welcome to India Today's social media page. I'm Milan Sharma. Let's look at what's happening in the pandemic that's once again taken China by surprise. China's not just reporting more numbers, they've also gone into the lockdown. 2 days ago, we reported how strict zero COVID policy led lockdowns had people in a tizzy in China. But now the number of cases are not being contained, not just in provinces such as Hong Kong, but also many other provinces where strict lockdown and curbs have been put in motion. Let's just go through what China's mouthpiece itself, Global Times, is currently reporting. They're saying that China is fighting its severest COVID-19 outbreaks, but responses are swift. But there are questions that are being raised. From 7 cases to 1,807 cases, affecting about 26 provinces and regions. Zilling province, which comes under this area, which has had more than 2,100 positive infections just on Saturday. And 1,412 of them are confirmed cases. China is also calling asymptomatic cases as silent carriers, which are more than 744 in number. In fact, so bad was the testing that the mayor of this Jilin provincial capital, Chang Kun, was sacked. And that is how the Chinese government is trying to contain the pandemic. But what is also being reported by China's own mouthpiece, they're saying that the Chinese feel that the COVID spread largely by Omicron has spillover because of the courier services or packages that were being delivered from across. They said that in the latest outbreak in Jiangsu province, a staffer working at the SF Express logistic park led to 49 more cases coming forward. And they have also suspended package deliveries and courier services from other regions such as Hong Kong and Macau. In this case, so packages are not going to mainland China. It's quite surprising because many studies have been done to ascertain that COVID infection doesn't spread or remain on surfaces for a very long time. It is airborne. When you sneeze or cough, then is when you are in contact with a person who's not wearing a mask or who's not following social distancing. And these are not new norms that are being followed by countries across the world. But earlier studies that said that COVID virus stays for a longer time on surfaces is not being supported by scientific evidence. And China is still looking at shutting down courier services and packet services. We spoke to a few experts on what it means for India as well, because when China starts reporting record number of cases, what does it mean for a country like India? We've had a COVID outbreak from the Wuhan province earlier. Let's listen in.
China is seeing a surge in COVID-19 cases, and many cities are going in lockdown. And as we know, China had a zero COVID-19 policy, and they were very strict with COVID protocols, and that had prevented from any major outbreak in China. But we see this outbreak is spreading very fast, and whatever reports are there, mostly it is Omicron, but there is Delta virus also. So, and the cause is that some reports are that it is spread through some international letter, or there are other causes. And I think this Omicron is mostly dominant in this case because it has a very virulent, or it spreads very fast, and whatever precautions they had taken, but I think it has found its way, and it has penetrated the Chinese this population also. And the question whether India will get it or not, I think the cycle is there that nobody is going to be spared of this disease, and by time we have to live with it. And I think India has given already its turn of Omicron, and if it is something else, we don't know, and if we have some new mutation or something new, which may affect us that nobody knows and it is difficult to predict. But still, considering that the outbreaks are still there, we still have to maintain all these precautions and COVID appropriate behavior. It has to be there. And I think we should we should be thinking, or we should be getting used to this disease. And as we know, lockdown, it wrecks all economies, and very difficult to say whether India is going to get a new, but whatever, we hope that we don't have this variant again.
You might have read in today's news that in China, southern city Shanghai, the COVID-19 outbreak has occurred. The whole city of 1.7 million is under lockdown. 2-3 days back, or on Saturday, people were in their factories and they were suddenly asked to go to their home and stay inside. Even they couldn't pick up their laptops and other essential goods. This city is famous for electronic hub. Particularly, they make iPhones. Their company Foxconn, it works for Apple iPhones. So all, I think now it's under shutdown. The technical hub is under shutdown. And what is the reason for this outbreak? Is the new variant come? Any sub-variant come that is more dangerous than the previous variants? So it is seen that it is again the same Omicron. It has various some lineages, BA.1, BA.2, BA.3, and they are highly infectious. So only thing is they have to contain the virus, do mass testing, and I don't think that this lockdown, the zero COVID policy of China would be successful. Only thing is they should vaccinate the whole population, and these COVID appropriate norms like wearing of the mask, social distancing, frequent hand hygiene etiquettes, they are the key to avoid this disease. Is India would be affected? I would say that India is still not out of the wood. This virus is still present in our atmosphere. It could travel all around the world. So only thing which can prevent us is we must get ourselves vaccinated. Already we have taken 2 doses. Few have taken the 3rd precautionary doses. Though it does not give you guarantee against infection, but the severity will be very less. It will be just mild or asymptomatic forms. So those who are not vaccinated, just get vaccinated and follow these norms. And India, our country, is safe. I see that the zero COVID policy of China is failing. What they do, few cases occur, they put whole city into lockdown. All people forcibly by their rulers sent inside the home. I think that is not the way out. Things are very simple. Just follow the norms, get vaccinated, get testing, get surveillance. That is the only key if we want to get rid of this deadly COVID-19 virus.
Well, as you just heard, experts are worried that this could lead to outbreak elsewhere because for COVID, the saying goes, it's not over until it's completely over, which means we're looking at surge in cases in Asia and Southeast Asian countries as well, and not just China. So definitely it could transcend borders and enter other countries, as there have been record relaxations in international travel as well ever since the pandemic started, and now after the 3rd wave in India. What China is also really concerned about is whether the Omicron variant can infect children like it does in adults, because India has already gone through a 3rd wave of Omicron infections. We have not seen, luckily, children being infected as severely as adults. Although China is notorious enough not to report the right kind of numbers, the numbers that we are looking at right now, deaths have also happened in various places, but in one of the provinces, it isn't a large number. The fatalities are about at 190 per day, but even that is not a less number and cannot be unaccounted for. Children are not being vaccinated in China. China is also looking at Omicron plus Delta variants together, and we'll have to wait and see whether China is able to weather this storm out before it can infect other nations or before the virus spreads from one place to another. Stay tuned to India Today and keep watching our social media page. Thank you for watching.